Fighting cancer is a hard battle, especially if your patients and families don't know where to go for resources. Well, Annet of the Cancer Support Community of Arizona is here to tell us how they can help find those resources and how important they are. Good morning, how are you?
I'm great, thank you for having me.
Good. Let's first talk about what the Cancer Community Center is all about and what you do.
Yes, absolutely. So we provide emotional support to all people impacted by cancer. So whether that's a diagnosis or in survivorship. And so the hospitals are really good at treating the cancer. We treat the rest of the person, the emotional needs, the social needs. Often people lose hope and they feel very alone. Yeah. So we have support groups, we do healthy lifestyle programs and education, and then also, as what you said, resources. Yeah. We provide them access to resources.
Yeah, and that's very important. As you said, the hospital's there to cure, but after they leave the hospital or while they're dealing with the hospital, it can be overwhelming to find those resources, yes, what they need. And people are very surprised of what a cancer patient needs, and even their families are. And that's, again, where you come in, especially the emotional support, which is really good. But really, the resources is really important because, you know, people live in different parts of the community, and there's stuff right in their own backyard they might not even know about.
That is absolutely correct. And we have a program that is relatively newish, and that is we have navigators in 3 of our Valley hospitals. They are in St. Joseph's, Banner University Medical Center, and Valley Wise Hospital. They work directly with the oncology team that when somebody's diagnosed, they then provide them access to the community resources that exist to them.
Yeah. And it's nice to have that face or that person there, even though the doctors are there, but they're the doctors.
Yes.
And that's where you guys come in, because it's a face that they can start recognizing, and it's friendly and so important for people to see.
Absolutely. And it also helps lift some of the burden off the medical team so that they can do the health care, and then we can provide that additional support.
So, all right, there's a lot been happening in our legislation.
Yes.
So there's something you're a little excited to talk about here, aren't you?
Yes, I am. And it's actually a federal bill. It's the MCED, and it's a mouthful, so bear with me. It's the Medicare Multi-Cancer Early Detection Coverage Act. And it's a act where we really would like to get, as soon as a cancer test is approved by the FDA, that Medicare will cover it. It's very important. About 70% of our Medicare patients die of cancer. So if we can catch that cancer early, they have better outcomes.
Yeah, and that is it right there, prevention, getting that taken care of. And that's again where you come in with the resources for that, because we know that when one family member gets cancer, somewhere down the line another one will. So if everybody's working together to help prevent, it's definitely something that needs to be done. 100%,
yes, absolutely. And so both our senators, Sinema and Kelly, are co-sponsoring this bill, and we really need it to pass this year.
Yeah, very important. We've been looking here at the center also too, as we've been seeing all the different activities, prom night, different things you're doing to help these families, which is so great. And that's what it's about. It's a community center for you, and saying, come visit. You know, even if you are a patient or not, and you have a family member might be, it's nice to come down there and be a part of that, isn't it?
Absolutely. We provide community to people impacted by cancer. We're proud of it, and you're welcome there. And all our services are free. Yeah. I think that's the most important part. You have enough to worry about to pay for your health care. When you come to us, you do not need to pay.
What I love is that it's a house. And don't get me wrong, I know there's places that have buildings, but sometimes that building can feel like you're going back to the hospital.
Yeah.
And I think that's why you guys have this house here, because it's a home.
Absolutely, yes. And it's an old home. It feels very welcoming, and our staff is there to welcome you in. But if you're not able to travel, we also provide Zoom classes, so online, so that you can stay in your home and then you can join us then. So we can create community anywhere you are.
Wow, this is amazing. So I'm so glad you came in and talked about this, especially at this time of year where families are needing hope and needing resources to make the holidays a little bit better and everything. And of course, the legislation that we need to make sure we're getting passed and taken care of.
Thank you so much for having us. We are supported by charity, and it is the end of the year, so we'd love if people can help support us so that we can keep providing these services. That will be wonderful.
That's perfect. We'll tell people how they can find out more information.
It's on our website, and it's CSCAZ, and it's from Cancer Support Community Arizona.org, and that's where they can donate.
Perfect. Thanks for coming in.
Thank you so much for having me.
Thank you.